Sound like they're on. Okay, there we go.
Call the roll, Ms. Conwell.
Here.
Ms. Stevens is absent at the moment. Ms. Baker.
Here.
Ms. Brown.
Here.
Mr. Miller.
Here.
We have a quorum.
All right. Anyone signed in for public comment?
Yes, Ms. Lou.
Welcome.
Good afternoon.
Good afternoon.
Well, today I'm here to answer the questions you actually did not hear on the November 20th meeting. Today is about repre housing. Let's see how homeless people actually can get really solid help from this program. This program actually requires you to be homeless, which is a given already. Then it says, oh, you need this, you need that. Those things are okay, as long as you have a good caseworker. The caseworker will help you to get the documentation required for the program, this and that, that's all good. However, please look at, maybe, I know Ms. Baker and Mr. Miller, you still have that chart. I'm not sure about Ms. Brown and Ms. Conway right now, if you still have that in hand. The colorful pages here. Yes, no, not the photo. The colorful pages with the delicious pies and bars. That's the one I'm talking about, pies and bars. So now, you did ask good question about how come certain percentage of the people are still in that kind of problem, this and that. So let me give you some kind of examples here so you will know how it actually works out or not works out for homeless people stay in the shelter. Actually, the thing is, you have to go through certain paperwork. We can all anticipate that. However, throughout this process, for the people who actually working really hard on their own housing, some of them may be really single, some of them actually may be a parent. The reason they may stay at a single adult shelter, that's because no space in the family shelter. However, fortunately, after they go through certain trouble, they can still access the family part of it as repre housing. However, the trouble comes in. Let's use just recent. Since May, YWCA already came in to 2227 Payne Avenue. All these workers, instead of helping me, I'm helping them answering their questions. They say, we already sent the fax for this particular person, XYZ, 3 times. How come still no response for her repre housing or for her whatever program to go through? So I told them, I said, now you have to make a call and you will get the answer as such, such, such. Every time they did it, every time they got the same answer I had told them. So from May, the popular location is called Rainbow Terrace. This particular place is on Kingsman, actually not too far away from CMHA headquarters. When you go through repre housing, you do have a help from housing locators. However, the housing locator to find something, it may not really suit your real needs. You may be a parent, so it's not only you want the location to be close to your job, you also want your kids to be taken care of, school or health care. Guess what? They all want you to go there because the data performance is their concern. If they pay for the higher rent of your choice, they will serve less people. Think about that. Thank you very much.
Thank you. Anyone else signed in for public comment?
No, no one else is signed in.
All right. If I could have a motion to approve the minutes from the November 20th meeting?
I so move.
Moved and seconded. All in favor say aye.
Aye.
Minutes have been approved. We have several items on the agenda today. If we can have the first item into the record.
Resolution number 2018-0253, authorizing an amendment to a master contract with various providers for out-of-home placement and foster care services for the period 1/1/2018 to December 31st, 2018, to authorize an exemption with regard to Homes for Kids of Ohio Incorporated in accordance with Cuyahoga County Code Section 501.12B10 to add a new provider, Homes for Kids of Ohio Incorporated, for the period 10/1/2018 to December 31st, 2018, to change the scope of services effective 10/1/2018, and for additional funds in the amount not to exceed $7,069,870.
And who is here to present?
Good afternoon, Bob Math with the Department of Health and Human Services on behalf of
Division of Children and Family Services, and with me is Elizabeth Neckloff, who's the administrator for the out-of-home care services for DCFS. We are seeking amendment to our 2018 out-of-home care master contract, also adding one provider where a child was placed there during the course of in this past quarter as a mission critical, bringing the total number of contracted providers to 40, and an additional $7 million. These services were initially competitively procured via an RFP in April of 2017 for the 2018 calendar year, and at which time we had allocated $43 million for these services. Given the increase in the number of children that have come into DCFS custody this past year, unfortunately, we have exceeded our allocated amount. We have been averaging approximately $4 million to $4.5 million per month in expenses. So this $7 million for 2018 should cover our projected expenses for November and December of this calendar year. I also wanted to add that during this past year, we began our monitoring activities for this contract, and we visited every provider that had children placed there during that time. Our monitoring included a review for basic needs care compliance, which includes medical, dental, school attendance, but also timeliness of service completion and their timeliness for reporting and documenting and communicating activities to the Department of Children and Family Services. In general, we found that most of the providers were in compliance with the terms of the contract, although there were several who fell a little short of our expectations. For those that fell short, we required them to submit a quality improvement plan. And then during the first quarter of 2019, we'll follow up on that improvement plan to ensure that they are implementing the plan as they've written. But overall, the monitoring reports were very favorable, and I think the providers are providing really high level and high quality services to the children that are in custody. And again, this is just an amendment for the 2018 master contract. So, if you have questions, Elizabeth Neckloff from DCFS, is more attuned to some of the programmatic aspects. You'll surely be able to address any questions you may have.
Bob, you stated the $4 to $4.5 million expense. Is that every month?
Every month. So this, given the carryover the dollars that were unspent so far after October, the $7 million would cover us for November, December of
Do we
2018.
know how many children this covers? I know this is just the addition, so I'm assuming that the additional children that it.
So currently, there's 2,515 children in out-of-home care. So that money would cover their placements.
Say that number again, I'm sorry.
2,515.
Okay. Now, that's not the additional children, because this is
No,
additional.
that's the
fund-
total number of children in care.
Okay, so do we know how many new children that we have on
So
the,
since the beginning of 2018 to today, there's been an increase of 400 children that have come into care.
okay.
So I think it's an increase of about 20%.
And we don't know what's going to happen the remaining of this month?
Correct.
Okay. Do we have, I'm sure we have a system of how many children you think might be coming off the rolls?
No, that's
you
pretty
don't?
hard to tell
tough.
since it all depends on court hearings where the parents are with their case plan. So it's hard to tell and project like how many children would be going home.
Okay. Open up any questions for committee? Okay, Councilman Miller, Brown, then Baker.
What's the nature of the exemption requested regarding Code Section 501.12?
Councilman Miller, through the chair, I'm not sure what you're referring to.
I'm referring to in the title of the legislation, it says that Homes for Kids of Ohio we authorize an exemption in accordance to Cuyahoga Code Section 501.12. Can the law department help us with that?
No, I understand the question now.
Okay,
I
fine.
apologize.
Okay.
These services, these providers were all competitively procured, when we issued the RFP last spring. The provider we're adding didn't go through that competitive procurement process, so we're doing exemption because that facility was able to take one of our hard-to-place children, so we had to add that as a mission critical. And so we had to bypass they were not part of the initial procurement process.
So this is an RFP exemption.
Yes, for that one provider.
Okay, fine. And can you explain what the populations are in these various charts that we have in the handout?
Oh, okay, so are you speaking of this handout? So the chart is showing you, the first one is all children in care. So that's the 25-15. That's the very first chart, the monthly trend for the year of 2018.
The chart only shows 277.
I'm not sure which chart you have. Oh, that's, okay, so you are, sorry, you're further into the packet than I am.
Right.
277 are children that are placed outside of Cuyahoga County, but within a contiguous county, so a county touching Cuyahoga County. So we like to break down our chart to show we like to place our children either in Cuyahoga County or a contiguous county. And if you look at the following chart, there's a total of 525 children still in Ohio, but in non-contiguous counties. So what this is showing is as the population of children in foster care grow, we are going further and further outside of Cuyahoga County to place the children of Cuyahoga County.
And the next one is everybody. It says all placement types,
Yes,
2515.
correct.
Network homes, what are they?
The network homes, those are our provider
Excuse
homes
me,
that this contract is.
Ms. McLaughlin, can you speak into the microphone?
Oh,
please?
I'm sorry. The network homes are the providers that are part of this master contract. So they have 1,107 of our children.
And residential placements.
Correct. Residential placements, there's a little bit of a error in that. It reads 162. There's actually a total of 147. There's a current provider in Cuyahoga County that their independent living site is classified as a residential, so when we pull these numbers. So we have a total of 147 children placed residentially. 10 of those children are actually placed outside of the state in residential facilities.
And how are the, we got foster homes 246.
Those are agency foster homes that are licensed through Cuyahoga County. So those are our foster homes here in Cuyahoga County.
We have kinship homes, placements out of state. And the ones listed as bordering counties and non-bordering counties, are those in foster care or are they getting a different kind of treatment?
Those could be foster care, residential care, or group home care.
Okay, fine. Okay. Okay, thank you.
Councilwoman Brown?
Thank you, Madam Chair. I'll go back to my questions. For the calculation, you said we're up 20%, and I was just curious, is there a calculation or formula that we use for the children? Is it per child or per day, or what is there a rate? How are we coming up with this number?
There was 20% increase in children going into care.
Right.
So at the beginning of the year, it started at 2103, and now we're at 2515.
So as far as the dollars, do you have a formula that you use to calculate, to predict the original was 40-something odd $1 million? What's the formula that we use to determine the original budget?
Councilwoman Brown, through the chair, there is no formula. When we issued the RFP, the providers indicated this is what their unit rate would be to provide these services. So, they're all pretty consistent, but some organizations charge a few more dollars per diem rate than others. So it is based upon a per diem rate,
It's a per diem rate.
and it's what they proposed, and then we negotiated that rate.
Okay.
A couple of them were a little too rich for our blood as well.
Okay,
So we negotiated those rates.
So it's a daily rate based on the number of children. And then I'm guessing because you indicated that there are some children that are harder to place than others, or do they have a higher rate
Yes.
of pay?
Yes.
Okay,
Every level, there's a level of care, so every level, there's a different per diem rate, plus there's a different per diem rate within each network. So if Parmadale or Catholic Charities can charge one rate for a level 4, and Guidestone charges a different rate for level 4, so it all depends on the provider, the services that they're providing, what their cost is per child, based on their level, and of course, some of the harder to place children are level 5 and 6, which are our highest. And then we do have some children that require a one-on-one rate, so that's an additional rate to the per diem rate.
it's like a 7.
Yes, or an 8.
Okay, all right, so technically we have 6 levels, and I'm imagining there's a range per level, so each level has a range that you're willing to accept at a maximum per diem rate for each level?
Correct.
Okay. And if you could provide for us just a breakdown of where the level of children, where they fall, the 2,500, how many are level 1, how many are level 2, how many are level 3, 4, 5, 6, and outside of the categories where they're one-on-ones. Do you have that?
I do not have that, but I can send that.
Okay, I think that would be helpful. I know, based on some of the interaction I've had with some of the workers, that there are a significant number of children that are hard to place. And so would really like to see that figure.
Yes,
All right, thank you.
you're welcome.
On that point, do the children ever change at their level in any way?
Yes.
Okay, thank you. Councilwoman Baker?
Yes, and that was one of my questions, the different levels and how they break down. I guess I would ask you overall, where do you find do you see a trend as far as what you see more of? I mean, unfortunately, we are increasing everywhere except for the continuous county chart. Looks like it went down. But overall, we're going up, I think, everywhere. So, you know, do you have any reasons, or do you have any comments on why it is we see an uptick in the trend, and can we anticipate that in year 2019 that this will be a continual uptick that will cost more dollars to fulfill the need?
Well, I think over the last probably year and a half to almost 2 years, there's been a continuous uptick. We do know the opioid crisis has hit, but not as hard as it's hit across the state. But one of the things that we run into here is that although we have contracts with these 40 providers, everyone in the state pretty much has the same contracts. So we're all vying for the same homes. So if we don't have enough homes in Cuyahoga County because they're placing kids into our county and we're placing kids out of our county because we don't have those homes. So I think there's going to be an uptick, and there's probably going to be another steady increase. I can't project how much, but I do see it continuing to rise with everything that's going on. And most of the kids that we do see are more difficult to place lately, which costs a little bit more money.
If I just may also, on the list that's provided for for those that are providing the services, is that district-wide? I mean, do you cover are there more in some areas than others? How does the demographics work with your list?
As far as the children or the providers?
The providers?
I don't think there's any more in some areas.
No?
We have 6 locally that provide care, but after that, most of them provide care across the state.
Okay, thank you.
Councilwoman Brown?
Thank you. Just to follow up on what Councilwoman Baker was asking, in addition to the levels, could you also identify what district those individual children are coming from for us?
Which district?
So the
Council district.
council district, and then there.
I don't know if I can, but I will see what our IT department can do.
Okay, even if you could maybe do it by zip code, that would be advantageous, and we might be able to see some trends.
Okay.
And then The other question I was going to ask was relative to the federal funding, there's 30%. Can you just elaborate a little bit on that? The funding resources is 70% HHS and 30% federal?
That's correct. It's
Okay.
Title 4E with
Okay.
30%.
So is it reimbursed, or we get a 30% reimbursement, or?
It's, Councilman Brown, it's reimbursement
Okay, all
from the
right,
state.
okay, thank you.
Any further questions? Anything else you guys would like to add?
I think that should cover it.
Do want to know if you want this, if you need this, looking at the date, second reading suspension, or can we do 3 readings?
The third reading would then be in January, so if we could do the suspension, it would be appreciated.
Yes, I'd rather you ask, because you know I want to do 3 readings. All
Well,
right.
actually, we submitted this we submitted it back in, a number of months ago, but just working it through. Sometimes with the master contracts, when we have to get 40 signatures, 40 providers to sign them, sometimes it causes unnecessary delays that we literally have no control over.
Okay,
But at least we got it in for at least the second reading suspension.
all right. Can I have a motion for second reading suspension to the full council? Sir, moved and seconded, all in favor, say aye. Aye. Let's move for second reading suspension.
Thank you.
All right, Madam Clerk, can you read the next item into the record, please?
Resolution number 2018-0254, authorizing an amendment to a master contract with various providers for out-of-home placement and foster care services for the period 1/1/2018 to December 31st, 2018, to extend the time period to December 31st, 2019, to authorize an exemption with regard to Youth for Tomorrow New Life Center Incorporated in Multi-County Juvenile Attention System in accordance with Cuyahoga County Code, Section 501.12B10, to add various new providers and for additional funds in the total amount not to exceed $46,200,000.
All right, can you state your name for the record?
Bob Math with the Department of Health and Human Service on behalf of Children and Family Services. This is our 2009, this is the amendment for our 2019 calendar year for the out-of-home care providers. And to Councilman Miller's question before about the exemption, there were 2 providers that were added as a mission critical during the course of the year that were, and so when we initially prepared the contract, those 2 weren't a part of that contract, but we since had added them because of the need to have some additional placements. So it brings a total of contract providers for 2019 to 42.
All right, so how many agencies bidded on this contract?
Oh, goodness. Council Chair, I'd have to go back, because the RFP was issued, a year and a half ago, it was issued prior to 2018, and this is just the amending contract. I'd have to go back and look at the initial, list. My sense was somewhere in the neighborhood of, over probably 50 responses.
Okay, and in your previous contract that we just passed, you said there was a few providers that were taken off. I assume that they're taking off of this one too, because they connect?
That's correct.
Okay. And what were the names of them? Because I take it they're not before us, the names are not on our.
I don't think there were any providers taken off. No, I believe there was a provider added, but I don't think there were any providers taken off.
Okay,
I stand corrected then, yeah.
okay,
Homes for Kids was added at the end for the last conversation, and this conversation is to add Youth for Tomorrow and the Multi-Attention Center.
okay. And can you share a little bit about those 2 new agencies and what they do?
The Multi-Attention Center is located, I believe, in Mahoning County, and it services boys and girls in residential care, which is another need that we have. So they needed to be added to the master in order to take a child that we are looking at sending to them. And then Youth for Tomorrow is actually located in Virginia, and it's a residential facility to treat human trafficking young ladies.
And how many children are going there?
We don't currently have anyone going to Youth for Tomorrow, but they have accepted a few of our girls in the past, but then we have found something locally, so we've kept the children locally.
And you said that was in Virginia?
Correct.
And we don't have anything here that deals with teens involved in human trafficking?
Currently, we have Grace Haven, which is located outside of Columbus, but they only have a limited amount of beds. And Foundations is another program that takes our girls, but they only have a limited amount of beds also.
And where's Foundations at?
I believe it's towards Youngstown.
Nothing locally then.
No, nothing in the local vicinity.
All right. And I take it that their parents are involved or their family support are involved in their lives?
Correct. For Youth for Tomorrow, if anyone goes to Youth for Tomorrow, they actually bring the parents down to Virginia on a quarterly basis. And they also do Skype family therapy with the parents.
Okay. What is DCFS oversight of these agencies, especially let's hone in on the ones that are out of town?
Any provider locally or out of town is assigned a resource manager, and the resource manager is to visit. If locally, they visit monthly. If out of state, they visit quarterly. Our workers are also to visit each facility every month to see their children.
The resource managers that go out quarterly to the agencies out of state, are there planned visits or are they surprise visits?
They're planned visits.
Okay. Are there any children currently in our facilities that are up for adoption, or are these all temporary cases?
In
In
foster
in
care,
the Board of Care
oh,
contracts?
there are permanent custody children in all of these sites.
There's some,
Yes.
okay. Do we have that number of how many?
No, I do not have the number of how many permanent custody children we currently have.
Okay. You'll get that for us, correct?
Yes.
Okay, and this contract here does the amount cover the additional children added in the previous contract?
Council Chair Conwell, we hope that it will. I mean, it's all predicated on where the children are placed, how many children come into care. We allocated, $46 million for 2019. We're hoping that, that was the allocation we were given, back in the, when we were preparing the amendment. Of course, that could change as it did in 2018, where we came back with adding additional dollars. We won't know until probably the third quarter, the fourth quarter of calendar year 19, if that's enough money to cover. It depends on the flow of children that come into the custody of the county.
Is there any way to show us how many children have come off the rolls in 2018?
I can
I know
check.
you can't predict because of, the courts cases and things like that, but I'm sure we have a number of how many have
I can check. with
come
that.
off. And did that, because it's not balancing it out. It doesn't seem like enough came off where we've added. But I'm hoping some came off.
In a perfect world, yes.
Who provides for the children's basic clothing necessities when they're in these facilities?
Part of the per diem cost is to cover clothing. When a child initially comes into custody, they do get an initial clothing order. But after that, the per diem rate is to cover their clothing.
So the facilities, they manage, a bunch of children. I could just see the shoe bill. They're managing and make sure that they have everything, the shoes fit correctly, all that.
Yes.
Okay.
And
They
as does
monitor that or we
as-
monitor
As
that?
does the worker of record who goes out to visit their children on a monthly basis.
All right, that's included. Open up questions for committee. Councilman Miller? Brown?
Am I correct that multi-county juvenile attention system and Youth for Tomorrow are on this list but are not on the previous list that we considered before?
Correct.
And why is that?
They are two providers that we are looking to contract with so that they can meet some of the needs of the kids that we have coming into care. Youth for Tomorrow, specifically human trafficking, and the Multi-Attention Center, we struggle with placing some of our higher level kids, our level 5 and 6 kids, and some of them end up in a a shelter for a time being until we can find a placement. So would provide another opportunity for those kids to go straight into a residential placement.
So currently, we don't have any youth in these two agencies, but we feel that the agency could effectively serve some of our children, and we want to have them available without having to use the emergency process.
Correct.
And of these other providers, do all of them have at least one of our children in custody, or are there some that don't have any?
I believe the majority of them do. The only one that I believe that does not have a child in it is New Directions, as that's a drug and alcohol program. And we haven't had a child go there in the last several months, but they've had a child placed there during this contract period. But currently, they do not have any children placed with them.
Okay, thank you.
Councilwoman Brown?
Thank you. And I may have not understood clearly. When we added the new provider homes for kids for Ohio in the previous contract, do we not anticipate using them next year? Or are they,
Yes, we do.
so are they on this list? I'm not really sure if and would they be listed as a new provider, given their exemption status, or how does that work?
I think they would just be included as a provider and not a new provider.
Apparently, it was inadvertently left off that list, but it's in the contract.
So should we add them as a new provider or previously approved, given that they're not actually approved?
As a previously approved.
Okay, all right, well, I guess we need to address that. And then the other question that I had, follow up on Councilwoman Conwell's question, I think Councilman Miller and Baker, with regards to predicting those that are aging out. What is the age that children age out of foster care?
It can range between 18 and 21, as long as a child is attending school. And then those that have developmental disabilities can stay. They stay a little bit longer.
Is okay. So given that range, is there some way to maybe kind of give a rough estimate of those that might be potentially aging out? Those that are at least of age 21 that are in school, we should be able to have some level of prediction, right?
Yeah.
Okay.
I can get that too.
All right. Thank you.
You're welcome.
Councilwoman Baker?
With the list of providers, I was surprised that the Youth for Tomorrow New Life Centers in Virginia. How many other on your list are not in Ohio? Is it a considerable, or is it just a few,
No,
or?
there's just a few. There's, let me get my report back out here because I marked them down. There's a total of 1, 2, 3, 4.
Four.
4 additional ones. But those were they were part of the master contract.
If I may, do we tend to use those as a last resort?
Yes. Yeah, and they each only have several children in them. So like I said, there's only a total of 10 children
Okay.
out of state, and those are the most difficult children, and those are children that we haven't been able to find a place in Ohio or.
And those are the 4 that we're talking about?
Correct.
Thank you.
You're welcome.
Councilwoman Brown?
The foundation earlier in your remarks, and then I was just trying to see clarity on that. Is that the same as the Bear Foundation?
No, it's actually Keystone Richland Center. That's actually foundations.
Okay, foundations.
Yeah, they go by foundations.
And you said the location was where?
I believe it's towards Youngstown, towards that way. I'm not 100% certain.
And it has been brought to my attention by our very diligent council clerk that Homes for Ohio is actually listed here. It's at the end of the contract, so we're good.
Okay.
We missed that.
Thank you.
All right, how many, could you provide us a list of how many bids for each agency that we have?
I can tell you how many, I can send you that information, but those beds are also available to the whole state of Ohio. So they're
Right.
not just our particular beds.
But on Public Safety Committee, for the out-of-placement kids that are in juvenile, they the contracts usually basically cover a certain number of beds that we're paying for, which means that they have to hold, other facilities are using them as too. Do we do that
We do
here?
not pay for anyone to hold a bed.
Okay. Okay. Any other questions? I was wondering, it's kind of off the topic, but in terms of the 4 providers that we have out of state, is there a way that we could work towards doing some kind of presentation so we can learn about some of these programs?
Oh, would you like them to come in and do, or would you like my resource
Well,
managers
they
to
don't
come
want to
in?
travel, but you know, technology, I don't know if we can do something like that.
We can do something.
Okay, just so, especially with the new providers, so we can be able to know or ask some more questions in particular about their, what they do. In terms of this contract, I'm assuming that please make that ask. Do you need 3 readings or what?
Yeah, we'd request that we suspend the suspension of second reading.
All right. Can I have a motion for second reading suspension to the
I so
full
move.
council? It's been moved and seconded. All in favor, say aye.
Aye.
Thank you.
Thank you.
Madam Clerk, can you read the next item into the record, please?
Resolution number 2018-0255, making awards on requisition number 42589 to various providers in the total amount not to exceed $3,500,000 for family-centered support services for at-risk children and families for the period 1/1/2019 to December 31st, 2019.
All right, and who is here to present?
Sorry to disappoint you. Bob Math on behalf of Division of Children and Family Services. We're recommending an award, and I'm sorry, I was going to introduce you, but this is Karen Storman, who's the Administrator of Support Services for Children and Family Services, who's really the subject matter expert on this. We're recommending an award in the amount of $3.5 million to the 10 listed providers on the agenda. It was under an RFP that we issued this past May for service to begin in January for something that we call family-centered support services. The purpose of this RFP was to offer at-risk and or multi-system involved families an array of intensive family supported services that will result in a safe and stable environment and improve family functioning for families and their children. This RFP consolidated a variety of services that in the past were being provided under separate contracts, and in some cases, separate contracts with the same organization. We combined these under this RFP this year. We expect there to be some significant savings by avoiding a duplication of administrative costs, thereby freeing up dollars to serve more families and more children. We issued this RFP, we received 15 responses, and we initially recommended 11 providers. Unfortunately, one provider withdrew during the course of negotiation. There was some language in the contract in the boilerplate regarding termination clause that they were not comfortable with, and as one of the delays for this, their attorneys contacted our law department, and the conversation was going back and forth, and eventually we couldn't reach an agreement, and the provider unfortunately withdrew. However, that being said, we don't anticipate that this would have any impact on our service delivery because the other providers that are offering the same service have the capacity to serve more families without increasing their budget.
The only question that I have at the moment, intensive family services, are these the services that are utilized for the children that were in the previous 2 contracts that are in our care?
No, Councilwoman Chair, they could be both.
Okay.
I'm going to let Karen just, tell you a little about the services. There's like 6 core services that are part of this contract.
Good afternoon.
Good afternoon.
As you know, the children and families that present to the Division of Children and Family Services often have complex social, emotional, and trauma-related challenges. We, as an agency, need to have ample service array to meet their needs. With this recent RFP, we chose to focus our efforts on many evidence-based interventions, which have a research and evidence to support that the outcomes for children and families prove to move in the direction of improved health and positive outcomes. Of those, we have many trauma-focused interventions, which many of the families and children that we work with are faced with. We have intensive in-home services. And to answer your question, Madam Chair, the majority of the services that we offer are actually geared towards children that are placed with their families in their homes to avoid and prevent a removal. However, many of the services can be and are also offered to our children in care, and will focus on supporting those placements, supporting reunification, and impacting the length of stay.
So children in care, and then the children in the foster system as well, is that what you're saying?
And we often reference children in care as those children in foster care,
Okay.
but the children that we work with also that are in their family homes, that are in-home family services.
Thank you. Continue, please. Is there anything else?
As I was saying, many of the services are in-home and we meet the families where they're at. We, in Cuyahoga County, we're resource rich, and we're fortunate to have many experts in the field of behavioral health and specialty areas, and so we really rely on our partners in the community-based behavioral health organizations that we access through this RFP to implement these services, many of which require fidelity to an evidence-based model or intervention, or require specialty training, such as wraparound intensive in-home services, parenting, trauma-focused services, etc.
All right. Mr. Mavs stated that there were 6 core services. Are those the ones that you just mentioned?
We actually have, I can list them out.
You could
Alternative-
send them to us.
Okay, sure.
But just to give you a sense of the services, I mean, they're all most of them they're in-home services. There's several different therapeutic modalities that are actually, that are trauma-focused. We have something called Nurturing Parents. We have supported visits. We have wraparound service. So it's a variety of in-home services and a parenting program. So it's kind of 6 core serves, but one of those core serves are evidence-based practices, which is a myriad of treatment modalities.
And not every family utilizes all the different services, correct?
No, Madam Chair, no. It was just based upon their specific life circumstances and their needs. But they have access to all these services.
Councilwoman Brown?
I guess the question that I would ask is if you could identify for us the families versus the foster care that you receive the services. And you might not have that now, but if you could provide it. Do you have it
I do
now?
have that information.
Okay.
I might not have it specifically broken down.
Some of the services are geared specifically towards our children in care. For example, supported visitation. Supported visitation is a service that is offered to children when they come into the custody of the agency, in which a brief treatment plan is developed to really engage the parent and the child at visit. So we have a parent coach coming in and working with both the caregiver and the children to make those visits as effective and positive as possible. They often come with a toolkit of sorts with puzzles, games, books that they can be interactive on the floor, no technology rule, maybe take a picture, but some of those are geared, services such as supported visits are geared specifically towards our children in care. Based on this list and these treatment services, the majority of the services that we procure through this RFP, though, are geared towards our in-home families with efforts to prevent children coming into care. So to offer intensive in-home family services to both caregivers and children who are experiencing some level of either safety concerns or other behavioral concerns in their home.
Oh, thank you for that. And with what you're saying is to prevent removal, but you also said that it's to help those that are already in care. So if you could just identify
Yes.
the number of foster families that are receiving the care, that would be helpful. Thank you.
Sure.
Councilman Miller.
Do the 10 agencies here provide the services themselves through their own staff, or do they subcontract with others?
And through the chair, Councilman Miller, these are all private by their staff, and they're required to have, depending on the nature of the service, many of them require special training, special licenses to provide some of this, especially some of the evidence-based treatment.
Okay. Okay.
Councilwoman Baker.
Understanding that these are higher level at-risk children, I guess is what we're saying, and we're trying to prevent those children from being taken out of their home by offering these services. Are there times when you find that because these children are at a higher risk, perhaps a more dysfunctional family, maybe drugs, alcohol, whatever it is that may be found, that you make a decision of whether or not, or they make a decision or recommendation that these children should not stay in the home? Where do you, for the safety of the child, how does that process happen, that this is not effective, the child is at risk, and no matter what we do to teach, it's not going to overcome the risk that we see happening, perhaps witnessing bruising or whatever? How do you handle that, or how do these agencies handle that?
DCFS will continue to partner with these contract agencies, and our primary goal is to ensure the safety of the children. Oftentimes, we partner with these agencies. There is a collaboration. They often meet together to discuss the family's need, progress on a case plan. If case plan services require one of these named services to be part of that, then the family is in fact then to comply. And so then it would be a decision to either bring the family and the team back to the table to discuss the concerns, either if they were related to noncompliance or there were additional safety concerns. The role of DCFS will always be to monitor the safety and protect the children. And that does happen. We will re-engage as an agency, bring the providers and the family to the table, and assess the situation and determine if the children can be safely maintained in the home or that we need to pursue a custody option.
If I just may follow, is that a long process? Is there a lot of red tape or bureaucracy involved in trying to get everybody together and discuss what's going on at the home, or is this, especially if it's elevated to a point where there's concern, that this can be done pretty quickly?
We at DCFS try to accommodate the family often and as best as possible, and so that family team meetings are based on their availability and their schedule, so there shouldn't be significant delays. Evasive families and other barriers may often present challenges. However, our staff and our agency will make every effort, should there be presenting concerns, to move as expeditiously as possible to address those.
Okay, thanks.
Councilman Miller.
What portion of these services are provided to children that are not in county custody? And what portion are provided to children that are either in residential or home placement or foster care?
I can work on getting the exact figures for you per the prior request, but if I had to provide a estimate, I would probably be comfortable saying around 60% are provided to families that our children are with their families, and that probably an additional 40% are provided to children in custody of the agency. But I can provide additional information to support that.
Any further questions? Seeing that this contract is for next year, what is your request in terms of?
Councilman Chair, we would ask for a second reading suspension, if we can.
All right. Can I have a motion for second reading suspension? Is there a second? Moved and seconded. All in favor say aye.
Aye.
Thank you.
Thank you.
Madam Clerk, can you read the next item into the record, please?
Resolution number 2018-0256, making awards on requisition number 42490 to various municipalities and providers in the total amount not to exceed $1,741,596 for various services for the Community Social Services Program for the period 1/1/2019 through 12/31/2019.
Thank you. We had a switch. Well, I hear different voices here. Hi there, please state your names for the record.
Good afternoon. Paul Porter, Health and Human Services on behalf of the Division of Senior and Adult Services. I'm joined by Marlene Robinson Statler, Administrator of the Division of Senior and Adult Services. This item is for the 2019 funding for DSAS's Community Social Services Program. That's the program through which we provide funding to senior centers throughout the county. We provide funding in 4 specific service areas. Those include adult development, which would be the typical activities like line dancing or computer classes that you might associate with the senior center. Congregate meals, typically lunches that are delivered at the senior center in a congregate setting. Transportation, either to and from the senior center, maybe to medical appointments or shopping, and then on field trips. And then adult day services, and we have 2 vendors that provide that. It's similar activities to what adult development is, but delivered to clients that have maybe a higher level of need, so there's more staff at those programs. This RFP was issued in April of 2018. We received proposals from 30 different providers, and as you see on the agenda, we're recommending funding for 26 different providers. The total award recommendation of $1,741,596 is the same as the current year funding for 2018. We have 25 existing providers that are returning for this contract, and we are recommending funding for 1 additional vendor, the City of Berea. And on the agenda, it was listed as adult development and transportation, both for Berea. Our funding recommendation is just for adult development for Berea. They proposed delivering both services, but based on the proposal review, our recommendation is just for that adult development service. And Marlene and I are happy to answer any questions you might have about the program or this item.
Do we need to change that amendment? Okay, that's fine. Someone had a question? Councilman Miller?
Are there any agencies that are currently being funded but not being proposed to be funded in 2019?
Correct. The RIBS Collaborative, which is North Royalton, Independence, Brecksville, Broadview Heights, and Seven Hills, they operated as a consortium of providers with Brecksville as the lead agency. They opted against submitting a proposal this year, so they won't be recommended for next year because they didn't submit a proposal. No current agencies that submitted a proposal were turned down for funding for next year.
Okay, and do you have any understanding as to why RIBS decided not to go forward?
There wasn't official communication about it. My understanding was that working as a consortium might not have worked best for their municipal budgets. So I do anticipate that some of those cities might apply on their own in the future. Do you have anything to add, Marlene?
In addition to that, this is Marlene Robinson Statler, Administrator for DSAS. In addition to that, Councilman Miller, we've had conversations with some of those that make normally applications for our senior centers, and some of the information regarding like our cyber insurance requirements and some of the other requirements are very extensive and very expensive in comparison to the funding that we actually issue to those municipalities. And so we've had ongoing conversations and meeting with them to make sure that there's a better understanding and clarification so that does not deter them from applying for the program and applying for the funding.
You would think that it would be easier to meet those requirements if 5 different municipalities are working together, but apparently not.
I believe the way it was designed, since Brecksville was operating as a lead agency, the insurance certificate had to be in that municipality's name. So I'm not sure if it was just the way to divide up payment for that. But again, we have gotten indications that it wasn't necessarily that they didn't want to participate in the program. So I would anticipate that we could see interest from them in future RFPs.
We've had ongoing conversations also with them and some of the other county districts to explain to them, if that is the only thing that is deterring you from applying, please contact us so we can have the conversations with you in regards to applying for the funding and not in lieu of the cyber insurance, because it is necessary to have that, but maybe a conversation around that entire insurance, especially if it's a joint project, how we can work with that, or if you have a rationale as to other insurances that are being provided to your entity.
You good? Councilwoman Brown?
Thank you, Madam Chair. So is there a cap per service and is there a cap per contract?
Sure. So we do make recommendations for funding for each vendor. However, since this is a master agreement, if we find that maybe one vendor is delivering more service than we anticipated, another vendor is delivering fewer services than we anticipated, we do have the freedom under a master agreement to move dollars around between the vendors without necessarily having to come back for an amendment. As to the question of a cap, we did this as a competitive process, so each of the providers submitted a proposal and indicated the rate that they wanted per unit of service. So that would be per hour for the adult development, per meal for the congregate meals, and then per one-way trip for the transportation. Some of those providers came in below what our capped rate would be, so then they will get paid at the rate they proposed. Other providers might have proposed a higher rate, but through internal discussions, looking at what our payment rates for 2018 are, and then calculating the rate of inflation between the last time we did these contracts, which was at the end of 2016, and what the current consumer price index is, we did increase those capped rates. So for the adult day, that's a daily billing rate. So a client gets a fixed amount for each day that they attend. That maximum would be $50.63 per day. For adult development, the highest rate that any vendor would get per hour would be $4.77 per hour. And again, some vendors' hourly rates are below that. For congregate meals, the highest rate that we would pay is $5.80 per meal. And then for one-way trips, the highest rate we would pay is $5.57 per trip.
In addition, Councilman Brown, you asked about with the contract and the dollars being capped. If we find, like we did have a provider, Goodrich Gannett, that was no longer with us, so the funding that would have been allocated to them, we then spread that through the other providers that needed more dollars based on the services that they were providing.
I might be overlooking it. The sources, the funding is coming from.
This is 100% funded by the Health and Human Services levy.
Okay. All right, thank you very much.
All right, Mr. Porter, from the, you stated earlier that there were 30 providers that submitted the bidding, but only 26 current providers. Did some of them drop off, or what happened with the other 4?
So our recommendation is for funding 26 vendors. There were 4 providers that we received proposals from that were not current vendors. We did not recommend those 4 for funding. We went through the proposal review process, and those 4 were eliminated from our recommendations as part of that review process.
Were they senior centers?
It was a mix of providers, some that are currently serving seniors, some that would be a new target audience for. Some of the proposals didn't meet the requirements that we had for each service. For instance, there was a proposal that included a virtual component rather than in-person services. One of the goals of this program is to reduce loneliness by getting seniors out of their homes and into a senior center for either a group activity or a meal or both. So while the virtual program might be a positive thing, that might have been a better fit for like innovation funding rather than funding through this program, because we're faced with many more requests for funding than we have the ability to deliver. For example, the proposals that we received totaled $4.2 million. And as you can see, our recommendation for funding is $1.7 million. That leaves a gap of $2.5 million in programming needs that we're not able to fund. So through that proposal review process, that's how we landed on recommendations for the 26 different providers. And again, that includes one new recommendation for the city of Berea.
Okay. And can you go over just a little bit about the proposal review process and when it was?
Absolutely. So again, we put this RFP out in April, and we actually opted to leave it open longer than the typical RFP process. We had heard from some vendors in the past that, you know, having a short window could discourage them from participating. So this was open for a little over 6 weeks. We had multiple review teams, including people from senior and adult services, people from contract administration and performance, our team, people from other health and human service agencies and county departments, and then some of our partners in the community that weren't applying for funding under this program but had expertise in senior services. So each proposal was reviewed by multiple teams, given an individual score. And then those group reviews were compared between the two of them, and we were able to kind of come up with our recommendations based on those multiple reviews for each proposal.
Okay. On the dollar amounts, is this something that, these are the rates that we pay, and I know we pay them on a monthly basis?
Correct. They submit monthly.
So they
invoices.
submit and then we
Yes.
pay them, okay. And that is per person, correct?
Those rates that I gave would be per unit of service. So like for an hour of adult development, for one meal, or for a one-way trip, not a round trip. They get 1 unit for each individual trip.
Okay, so unit of service, there could be 5 people on the bus. You're just paying them for that?
We're
taking
paying for that one person. They
Okay.
get payment for each person that's on that
Okay.
bus during that
Okay.
period.
Okay. All right. Councilman Miller?
Looking at the agencies that we're contracting with, how good is the geographic coverage? Do we have services available to pretty much all seniors anywhere in Cuyahoga County, or are there areas where we have gaps where there's services not available?
Councilman Miller, including the new addition of City of Berea, we have centers in every council district except for District 1 at this time. And we're working right now with District 1 to look at funding for the future with them applying for additional services through our next RFP.
And are seniors able to attend programs in neighboring communities if their own community does not have a program that's funded, or are people restricted that they can only go to services in their own community?
Now, there are some restrictions at some of the senior centers, but in certain communities, like in District 1, they have a collaboration of 8 different municipalities and communities that work with their senior centers. What we're looking for in the future is to look at providing funding and providing more clarification on funding so we don't deter people from applying. Right now, we don't have representation, particularly in District 1, but people are allowed to use senior centers in other areas.
And I would add that what we've seen is sometimes municipalities, if they're paying for services out of their municipal budget, they might restrict and say, we won't pay for transportation outside our district. But if you come in and want to participate in activities or get a meal, they would work with us on that. Many of our nonprofit partners that maybe are located in a particular neighborhood, but they're not a municipality, we typically see fewer geographic restrictions with those. But again, particularly with regard to the transportation, most of our vendors have a specific area that they will do transportation in. And then other than that, our only requirement for eligibility is that you either be a senior, which we consider 60 or over, or ages 18 to 59 and with a disability. So there's not an income restriction, and you have to be a Cuyahoga County resident. We have had questions about people that are visiting. Could we pay for services? We would encourage people to come look at our senior centers, but we won't pay for non-residents.
Okay, thank you.
Councilwoman,
Thank you, Madam Chair. Just a point of clarification, so when these contracts are awarded, the city specifically, not the agencies, but the cities open their centers or their city up to all Cuyahoga County residents to receive these services. Is that what I'm understanding?
And it depends on, say for instance, I'll use for example, the city of Solon.
Okay.
The city of Solon, we provide funding for their adult development program. They provide their own funding and their own city funding for transportation. So they would not pick up customer that may live in Bedford. But if that person from Bedford could provide their own transportation to get to the senior center, they may be able to participate in their services. So it depends on each individual senior center and what services they're receiving.
Okay, so City of Maple, well, we'll go with Bedford Heights for transportation services, which is an interesting question I have. So if someone lives in Warrensville, are they able to use the transportation services in Bedford Heights, I guess?
Again, for transportation, that is one that most of the municipalities restrict to just their residents.
Just their residents.
In particular, we get so many requests for funding. Often we have to decide to provide less funding than what the vendor is proposing. So if it's already a small amount of funding, those municipalities may decide that just based on this slice of the pie that they're getting, they can only transport their residents.
And
that's what we typically
And
see.
that is, those restrictions are fine with regards to transportation, but as it relates to congregate meals and adult development services, those services are available to anyone within the county that can get to that particular center?
That's the way
Senior
most.
Most of
yeah.
the senior centers work. Like, and so the example that you use for Bedford, when we provide transportation services, they may receive, they may have congregate meals there. We may not be funding them, but maybe Western Reserve Area Agency on Aging is funding them.
Right.
So they may not want to utilize our dollars for that, but they want to utilize the dollars we could provide them for transportation.
Okay, and along those same lines, where you have a city like Maple Heights, and let's say they have congregate meals, and the neighboring city is Warrensville Heights, the resident in Warrensville Heights could essentially go to Maple Heights for the congregate meals, is that, or no?
If they do, most cities would determine kind of their allocation or what they have available funding for based on their own budget. We don't explicitly require the municipalities to be open to anyone outside that. That's not a specific requirement. So it's more on a city by city basis what they would decide.
All right, so that's not an expectation that is set, that is,
It's up to the city.
okay.
It's up to the city. We encourage people to use the senior centers, but understanding from 2014 and on up till now, the number of people using our services, the numbers continue to drastically climb. And so we're always trying, if we were, say for instance, to open up Warrensville to Bedford residents, then we run into a problem with mid-year, them not having enough funding to make it through the end of the year. And so we trying to balance both of those entities. Some of the numbers, and I think we serviced in 2014 approximately 1,400 people. In 2018, by mid-year, we've serviced almost 3,000 people.
More than double.
And so, right, and so as we progress and the numbers continue to climb, it'd be wonderful, and most of these centers do open their doors, and especially I applaud, especially in District 1, the Collab 8, where people are allowed to go to various senior centers in that particular geographic area. But in some of our other senior centers, if we were to open the doors to everyone attending every senior center, the funding is just not there to support. If you're serving congregate meals to 100 and now you offer 50 additional people to come from another area, then we run into the same problem. We always run into a shortage of funding.
Okay, so just based on the 2.5 deficit that you said the programming would need, where were we as far as funding in 2014? Do you recall? We have not doubled our budget. I'm sure it wasn't 800,000.
No, we can provide, I don't have those figures with me. We can provide those figures for you, Councilman Brown. We don't have them with them, but we were not at the same funding level.
Okay.
It's been a modest increase.
Yes.
Okay, and if I heard you correctly and during the opening remarks, this is not an increase, this is the same amount from the
Correct. The
previous
same-
year.
For 2019 will be the same amount. Yes.
Okay, and finally, I don't know if you have this on record and you can let me know afterwards. If not, did the city of Warrensville in fact present or submit a proposal for these services?
We did not receive a proposal from the city of Warrensville.
Okay. All right, thank you very much.
Councilwoman Baker.
Okay, I know that you have reached out and are talking with my district, which I appreciate. But this, I don't think, is the first time that we have not been part of this list. And so there has been at least a year of hopefully some talking back and forth as to why this is a good idea to apply. So since that year has come and gone, has there been any movement on applications on the 5 cities? And if not, do they give you a reason why?
We didn't receive any applications from District 1. That is a point that Marlene has consistently brought up at the Cuyahoga County Senior Services Network, of which several District 1 senior centers participate, and I believe even the chair represents a District 1 senior center. As Marlene alluded to earlier in the presentation, sometimes the awards that we can offer are seen as small in comparison to the work that goes into putting together a proposal. It could be a factor like that, wondering if you're going to do all of this work for a proposal to get an award that might seem small compared to their overall budget. Again, the example given of collaboration that's already going on in District 1, perhaps that makes it less appealing for a specific senior center to apply for fear that that would take away from the collaboration that's going on. I will say that we continue to make every opportunity to apply available. And I know I mentioned that we had 30 proposals, but this RFP was sent to a mailing list of 215, and that includes municipal leaders, senior center directors, specific staff members at senior centers, and we sent it out by both mail and email, as well as made frequent notifications through the Senior Services Network. So I don't believe it was a case that there were senior centers that weren't aware of the funding, let's put it that way.
And to follow, of those that apply, I know most of these you said were incumbent services. Those that would apply outside of receiving services before, are they, for the most part, guaranteed if their application is submitted? How do you, what is the, how do you determine who does and who doesn't?
So as we indicated, we do go through a thorough proposal review process.
Right.
There are questions in the RFP about, providing evidence of prior service delivery. Obviously, the incumbent providers are able to provide, results of monitoring visits from us. They're able to indicate how many years they participated. However, we will consider records of service delivery from other funders. So using the example of Western Reserve Area Agency on Aging, which provides federal dollars for meals, most of our providers that do congregate meals get funding from us and Western Reserve Area Agency on Aging. There's other funders in the community, for instance, transportation through United Way. We would accept evidence of that service delivery as well. So we don't consider that if you're a current vendor, you're guaranteed to get funding moving forward. Likewise, we wouldn't necessarily say we're going to fund anybody that submits a proposal. They would have to go through the same review process or the same type of review process that we did this time around. But our goal is certainly to fund services throughout the county.
And Councilwoman Baker, in addition to that, we do have ongoing meetings with District 1, and in particular, I've made a commitment to all of the senior centers, in addition to District 1, to go and visit each one of the senior centers, not only because of the dollars and the funding, because right now we want to look at also the impact of what those dollars have on the people that are using the services. So we started visiting. I visited Solon, I visited the Fatima Center through Catholic Charities, and making a commitment to all of them and having those ongoing conversations so that when the RFP does come up again, that everyone is aware, has the information. We have the most updated mailing list, and so there's no way anyone is missed. If you want to,
Okay.
in
Well, I
shorter
will
terms.
certainly do my part and circle back.
Yes.
And ask why it is they weren't included on this list, try to get an idea of perhaps, as you say, it's just not enough for what it is that they're granted. Maybe the cyber insurance played a role in that, although the others were able to overcome that, so I'm not sure why that would be a problem. But it's, on the surface, it's disappointing, but I'll have to dig in and see exactly why it is that they're not participating.
As we indicated in the pre-proposal conference, where there were vendors from District 1 who attended that, we would ask any provider that's interested in delivering the service, if there's a hurdle or a barrier, include that in the cover letter of your proposal, and we can talk through that if we decide that your program is worthy of funding. We can certainly ask about that. I mean, we're very specific about working with providers.
Prior to this contract, when we went with District 1, the part of the reason that they were saying some of the contracts they hadn't applied for them was a time frame. So this one we made sure was at least 6 weeks in duration, so it was a longer time frame to apply for the contract. But other than that, the only other thing that were shared with us was in regards to investing all the time and the energy in comparison to the dollars that are allocated, along with looking at some of the expenses for the cyber insurance and some of the other entities.
The only thing that I may just add is, if you're doing this for the first time, where others have certainly know it, they just push a button, fill out whatever needs to be added, and they submit. Those that are starting at 0, 6 months or 6 weeks doesn't seem to be like a very long time, and it may be an extended time, but this still doesn't seem to be a long time to submit at 0 to participate in, how long of a process is this?
So this time around, as part of the county's move towards the Division of Contract Administration and Performance and centralizing operations, this RFP was substantially different than the prior RFPs. So even incumbent providers couldn't necessarily dust off their old their old proposal and resubmit that. It was, I would say, substantially different. And we heard feedback from providers about that, not all of it positive. However, I would say that we don't necessarily craft RFPs that are easy to respond to, but we don't try to make it difficult. We want to make sure that we're funding the best programs that are out there. It would be nice to offer funding to each and every program, but we did have to make some hard decisions about recommendations. And the flip side of that is knowing that it takes a lot of work on the part of the vendors. We put countless hours into reviewing their proposals, making sure multiple sets of eyes are on them. So I would say we try to balance it as much as we can, and we added 2 weeks to the length that it was open.
In addition to that, we do have the pre-proposal conference, and that is the venue for those new providers. We invite them to ask the questions, also informing them if they have additional questions or additional information they need, how to contact the contracting department, and if they have specific questions or guidance that they need, that we can provide that guidance for them.
All right, well, I'll do my best to double back, and thank you for reaching out to them also.
Okay, why are we contracting only for 1 year? Why is this only for 1 year?
Our intention when the RFP was released was to have a 1-year contract with 2 options to amend. What we looked at is the current funding is obviously the same as it is in 2018. I would say based on feedback from providers, again, there's a funding gap, so we didn't want to necessarily commit to funding at that same level should funding change for what we're able to offer vendors. So
And
that was part of the
going
reason.
forward?
Uh,
And going forward?
Yes, going forward.
Okay, so is this the first year in the two options, or just?
This
we're
is
just
the
gonna
first
single-
year, and then there would be the option for a second year and a third year. So
Okay.
potentially 3 years from the same RFP.
But those amounts could change. is what you're
Exactly.
saying.
That's why we didn't want to lock into a 2-year amount. We wanted to take it with 1 year at a time.
Councilwoman Baker.
So if this, I heard 1 year, and I thought, good, that gives my district an opportunity to submit in the, but did I hear that this is locked in for 3 years, so they will not have an opportunity?
Certainly not.
Okay.
We are not looking at this as something that's locked in, and I would say that the perspective is if we have the opportunity to add vendors, that's certainly not something that we're opposed to. This would just give us the option to extend by amendment, so we didn't have to do a full RFP process each time.
What are the chances that you would open it up for more cities if it's set up for 3 years with the current list?
We found in the past, and I think I've mentioned Goodrich Gannett was someone that we had as a provider, we no longer have, so then there's additional funding there. So when we also do, and the contracting department does evaluations. So obviously if we find that a vendor is underperforming or something like that, there may be some issues with that. We also look again, it's still one pie. It's always one pie, but we look at how we can divide it and possibly add, because we want to have representation from all of our districts.
And if that was the case, we would likely have to request an RFP exemption to add a vendor to the master agreement. Or we could look at doing kind of a targeted RFP to open it up for new vendors, but not necessarily that everybody would have to reapply.
Okay.
Councilman Miller.
In the current round, how many non-incumbents applied, and of those, how many were funded and how many were not?
Absolutely. So the 4 proposals that didn't get recommended for funding were all non-incumbent, and there was 1 proposal that was from a non-incumbent that we did decide to fund. So Berea was not an incumbent provider.
And who were the 4 that were not funded?
The 4 were By Leaps and Bounds, FASTAR, Fairhill Partners, and the YMCA.
If I may follow to that? So it seems on the surface that incumbents definitely have an advantage.
That would not be our perspective because we went through the proposal review process with each of them without giving an advantage for incumbency. This was a bit of a unique case because we were fairly specific about the requirements for service delivery for each of those 4 services I laid out. And 3 out of the 4 proposals that were, really 4 out of the 4 proposals that were not recommended had substantive differences from the service delivery model that we prescribed for everyone. So it was in a way comparing apples to oranges. If we're asking the senior centers to deliver adult development that looks like typical senior services, if we're asking them for congregate meals or transportation, those are fairly specific services. And I will say that each of these that were not recommended for funding, it was in the adult development area. We didn't have an example of one of these providers, for instance, proposing something like congregate meals or transportation. They were all kind of very different models than what we were looking for, but they were applying under the adult development type of program.
So in the terms of new providers being added, the only way that I apologize. So the only way that they're allowed to apply, they can apply. You have an open process for them to apply, but unless the funding increases some kind of way, or someone doesn't get evaluated properly,
Sure.
You're saying that we really can't.
On the
offer.
current funding, I mean, we're continuing with basically the same amount that we had in both 2017 and 2018. That's what these recommendations are based on. So again, we would likely have to request an RFP exemption to add a new provider. unless, doing just a one-year agreement would allow us the opportunity to go back out for another RFP sooner rather than locking us in for 2 years. There's kind of a flip side to the one-year agreement, I suppose.
But it still increases the budget overall. whether
Exactly.
you're
Adding
doing an
new vendors
exemption or
would
not.
have to increase the budget. Otherwise, we'd be taking away from the vendors that we're recommending funding for right now.
Right, okay, so I just wanted that to be clear. As in terms, going back to the rates, you spoke about the rates paid to the agency per unit was last done in 2016. When will there be another rate adjustment, and who determines how that rate adjustment gets increased?
So these rates were determined in part based on what the providers proposed, and then in part based on the current rates that we're paying right now, knowing that the proposals were so much more than what we had funding for. We had to maintain a cap. There are current contract caps in place for each of those services. So to make it as fair as possible, we just index those capped rates to the consumer price index. There wasn't necessarily, any determination other than that about, well, this provider should make more than that or this provider should make less. If their proposed rate came in under the cap, they're going to get paid their proposed rate per unit. If it was over the cap, then we asked each of them, are you willing to still provide this service at the specific capped rate? And we didn't have a single provider that turned us down on that.
Okay, so it's based on the market.
Exactly. And if we had to do another RFP, our goal would likely to be adjusting that again with the rate of inflation.
Okay, so I guess, can you get the committee the numbers, or we can talk more in depth offline in terms of the increases that you've had, and especially if we want to be able to find some funding for
Sure.
District 1 residents that are
Yes,
in need.
we can provide the client count increases from 2014 up through mid-2018.
And I will say, I just crunched the numbers based on our mid-year report while I was sitting here, and we're up about 10% from the end of year 2017 numbers to the mid-year 2018.
That's a 10% increase?
A 10% increase in the number of clients just between 2017 and 2018. Or rather, a 10% increase in the number of units of service delivered.
From 2017 to now?
From 2017 to mid-year of 2018.
mid-year.
I'm kind of basing those mid-year
And
projections
what's your mid-year, around June? Is that
on
what you-
June 30th. Yep.
Okay.
So if those mid-year projections hold out for the whole rest of the year, it would represent about a 10% increase. So we won't know that until the annual report is compiled in February.
Okay. Councilman Miller, then Baker.
Since we don't have any more money, does that mean that if there is a 10% increase in the first half, that sometime before the end of the year, that you're gonna run out of money?
We typically do exhaust our funding for this program prior to the end of the year. Some providers exhaust our funding much more quickly than others. We typically see the municipalities being the ones that will submit bigger invoices and then just pay it out of their municipal budgets. The way we look at this funding is it's to supplement their existing funding for services. We're not funding the entire senior center, and many of them, as we mentioned, Western Reserve Area Agency on Aging is another funding source. They do in-house fundraising if they're a nonprofit. Maybe United Way provides some funding. So we look at it as a piece of their overall funding, and again, it won't last through the end of the year for most of these providers.
Councilwoman Baker.
Just to make sure I have an understanding, if you were to select outside of Berea, who is not an incumbent supplier, how would you, and you'd say those 4 did qualify, maybe a few more qualified, and now you've got 5 or 6 new providers along with the traditional incumbents that you already have, how would you have supplied them all? And would the incumbents have an edge over the non-incumbents given the lack of resources and the history of these others showing that they have provided the services in the past.
So as part of this process, we ask the vendors to submit information about their prior year service delivery, and we did evaluate without looking necessarily at what their current level of funding is, looking more about what their prior service delivery was, because we might have a provider that's funded at the $25,000 level, and they delivered $150,000 worth of services through a mix of funding sources. Meanwhile, we have somebody who's funded at $100,000 and they came in under that, like $95,000. So we tried to balance that demand for funding among the senior centers. When we came up with these recommendations, as Marlene mentioned, Goodrich Gannett had been a service provider prior to the current contract period. They intended to come back, but then they shuttered their operations. That allowed us some freedom this year to distribute those dollars to other vendors. For the 2019 recommendations, there are some providers that, based on their 2017 service delivery, because that gave us a whole year to look at, that will experience an increase compared to what their current funding is. The flip side of that is there are some providers that, based on their 2017 service delivery, are getting a lower recommendation for 2019 funding. So just because they were an incumbent provider didn't guarantee a certain level of funding. We tried to distribute the limited dollars that we have available as equitably as possible, given, again, that prior service delivery.
I guess I'm just a little confused on the prior service delivery. If you have a service provider who has never provided services before
Sure.
and doesn't have a history to share with you, and you have an incumbent list that has shown in the past, even if it's less than others, but they still have shown delivery,
Yes.
is there an advantage to those that are incumbents that have provided services in the past? You know, some are stronger than others.
Sure.
But there's still, how does someone with no history compete with the dollars that are given to perhaps eliminate one of your incumbents and put in a non-incumbent who doesn't have a history but is applying for the first time? How do you balance that?
So one of the requirements with the RFP is that you have to be a senior center that has been in existence for at least 2 years delivering service.
Okay.
So we ask them, how many clients did you serve in 2017, even if it wasn't with our funding? So that gives the vendors a chance to say, you know, we have 500 citizens that come to our senior center and they took part in 25,000 hours of programming. So that that's the way the city of Berea was evaluated, for instance. They were able to provide evidence of service delivery, not necessarily under our program, but again, because they've been operating, they could provide evidence of what services they were delivering, either with their municipal funds or funds from a different funder.
So if a city like Fairview Park, for the very first time, submits, and they can show that they have so many citizens that they provide for, even though they're not part of your program, would that bump one of the other incumbent cities in order for you to spend the same amount of dollars? Would, say, Maple Heights, who doesn't show perhaps as many as Fairview Park could potentially? I mean, how do you balance someone who's not had the opportunity to be part of this program, or at least be accepted into the program, or even felt that they should submit into the program? How do you balance that? It just seems that the incumbents here, I haven't heard really a good argument where the incumbents aren't given first, given the criteria that you're asking, how they don't come up on top for being selected. I mean, where am I missing that?
So the only part what Paul had mentioned in regards to, like, for Berea, they provided information outside of what services with us, where they had provided services. So that gave them basically the same level playing field of someone else who's already been providing services, because we know they're providing services to the community. In addition, they showed us the number of people they're providing services to. What will happen though, because it is still only the same amount, the dollars are flat, we're not getting any more dollars, that may mean that another senior center, an incumbent or someone else, their dollars may be lowered in order for us to provide to another, if we had a new senior center coming in. So we looked at is in 2017, overall services. So as Paul mentioned, there may have been an incumbent that previously received $200,000 the previous year. This year, they may be receiving $175,000, so that, for example, and these are numbers are not correct, for the city, to add the city of Berea, we gave them $25,000.
I see.
So because it's the same amount of dollars and there's been no increase, we have to then look at either we're gonna have to decrease, if we're gonna increase the number of senior centers, it means decreasing some of the funding for some that are currently in existence.
Did I hear you say that one of the senior centers they took themselves out?
Yes.
And that in itself allowed for more funding to be looked at for Berea?
Precisely. So Goodrich Gannett had been a provider up until the end of 2016. They submitted a proposal for 17 and 18, but they had ceased providing services prior to the end of 2016. So those dollars that had been budgeted for them for the current contract period, we were able to redistribute those. So, and some of that thinking was what we used in 2019 to come up with the recommendations. We didn't just say, well, there's 25 other providers, so we're going to split it up 25 different ways.
Right.
We took a look at what service utilization was and made distributions based on that. And I want to make sure that I was clear about when we asked for a record of service delivery for people that aren't current vendors, we asked for hard numbers on the number of clients actually served and the number of units of service delivered. So it wouldn't be, Fairview Park has 25,000 people,
Right.
Maple Heights only has 15,000 people, so that's how we made the determination. And really, as Marlene said, we hold the incumbent and non-incumbent providers to the same standard. And again, it's part of the RFP. We didn't necessarily look back into our billing records and do the legwork. We asked the providers to put that in their proposal so that when those reviewers who might not be as familiar with the program and the dollars and cents for each vendor, when they were reviewing those proposals, they could evaluate a non-incumbent on the same playing field as an incumbent provider.
And I'm gonna have to move on.
Yeah, if I can just ask just one last, I'm sorry, just to make sure.
Got 3 more.
This is it, I'm sorry. If the supplier did meet the standards, which they didn't, but if they had and they were incumbent, would Berea be in this list?
I mean, we went based on the proposal scores. So Berea's score was high enough that we did want to include them.
Okay.
So if they were in the list, as Marlene said, we might have had to adjust what the distributions were to be able to include them.
Okay, I appreciate your answers. I thank you very much, Chair.
And it's very beneficial to go to one of those
Yes, Council.
pre-proposal meetings. They are in depth, and you could see the agony and how they really,
Yeah.
I've participated in those in the past. So what is it regarding this contract, Councilman Miller? So we have
I
3
was
more.
just gonna presume that they want second reading suspension
I was
like
getting ready to
everybody
ask. That
else
was
and
my
make a
next
motion to
question.
that effect. Because it would be well into January if we did 3 readings.
And this is a
that your ask?
1/1/19, so we would appreciate it if we could do the second reading suspension,
All right,
please.
Mr. Miller, can you make that motion,
I
please?
did.
All right. Moved and seconded. All in
Thank you.
favor, say aye.
Aye.
Second reading suspension. Thank you. Next item into the record, Madam Clerk.
Interesting conversation.
Resolution number 2018-0257, authorizing amendments to agreements and a contract with various providers for various programs and services for the Cuyahoga County Fatherhood Initiative for the period 1/1/2018 through 12/31/2018, to extend the time period to 12/31/2019 and for additional funds.
Good afternoon, Al Grimes from the Office of Health and Human Services and the Office of Child Support Services. These contracts represent the final three of the programs to be funded by the Cuyahoga County Fatherhood Initiative from January 1st through December 2019. They were originally recommended as a result of a fatherhood RFP that was issued to the community in July of 2017. There are a variety of programs designed to assist fathers with meeting both the financial and emotional needs of their children. They range from job training and placement to boot camp for new dads at 9 hospitals to ensuring their fathers stay involved in the academic lives of their children in K-8 schools, to a prevention of premature fatherhood program for teens to deter them from being fathers until they are financially and emotionally ready. These contracts will allow us to continue to serve fathers and families in Cuyahoga County in a much needed and critical capacity. Our mission is to significantly increase the number of fathers who are involved in nurturing and raising their children. Research has shown that when fathers are involved, children are less likely to drop out of school, become incarcerated, use drugs, commit and become teen parents, along with other issues, commit crimes and become teen parents. When fathers are involved, children live a more healthy and impactful life. So that's the background of the Fatherhood Initiative. And these are the final three programs. You guys approved the other 8 last week.
Okay, so these are, that was gonna be my question. So we approved some last week.
Correct.
And these are, the same time frame.
Yes, ma'am. Same time frame, starting
Just
from
different programs.
different programs. Some of the programs made it through the OPD and legal system ahead of the other 3.
Okay. They just didn't get their signatures and all that.
Correct.
All right. Any quick questions? Councilwoman Brown and Miller.
If you could just very briefly describe premature and how many people are in that particular program, or at least the target for that program, and how is it executed?
Yeah, the target is teen males from 11 to 18 years old. And last year we served 1,905 teens, where we're going out to community centers and to schools to talk about not becoming a parent until you're ready. You know, what's the cost of becoming a parent? What's some of the peer pressure that you incur at school to have sex before you're ready? Healthy dating relationships, everything around leading teens in the right direction so that we can prevent fatherhood among teens, which, obviously serves the county very well. There was some research done in the past where over the life of a child, one who drops out of school and becomes a teen parent, and just one who graduates from high school, the difference in their earning income over the next 20 years is $200,000.
Councilman Miller.
Madam Chair, Director, what is the total budget for the Fatherhood Initiative for 2019?
The total Health and Human Service budget is $832,000. I'm sorry, $825,700. Yeah, we had to reduce it by $6,500 this year.
So that's $6,500 less than this year's amount.
Correct. Under 18 Health and Human Service levels dollars. That's correct.
So, is the one contract, the Towards Employment contract, that alone is more than half of it?
No, the Towards Employment contract comes from 2 funding sources. $93,500 is Health and Human Service dollars. The other $390,000 is a grant that we received to operate the Families Forward Demonstration Grant, which is a program where we're taking individuals who are paying child support and trying to convince them to go into 3 or 4 occupational tracks where they would come through child support. We're going to do an assessment of them. They're going to go towards employment for soft skills, and then from soft skills, they'll go to some operational tracks, and it'll be either truck driving, IT, customer service, or just one more. I'll remember the other one.
So, Director,
Oh, CNC machinery. I'm sorry. Yes, sir.
so what is your total budget for 2019 regardless of funding source?
Okay, if you include the other 380,000, it'll be 1.3 million. If you include the other 380,000 of federal grant dollars.
So Madam Chair, Director, is that the only source of additional funding you have besides levy dollars?
Yes.
Okay, fine. Thank you.
All right. And your ask for moving this along?
Yes, we'd love to have second reading suspension so that we can get this finalized by the end of the year.
So moved. Second.
Moved and seconded, all in favor to move this to the full council for second reading suspension? Say aye.
Aye.
All right,
Thank you very much.
thank you. Next item into the record, please.
Resolution number 2018-0258, authorizing a contract with the United Way of Greater Cleveland, the amount not to exceed $1,095,450 for fiscal agent services for emergency food purchases.
Bob, who do you have here with you today?
With me today is Ben Miladin, from United Way, from United Way Services, serves our liaison between Health and Human Services and United Way. This is requesting approval to enter into another contract with United Way Services for calendar year 2019 to continue to serve as a fiscal agent overseeing the allocation and distribution of funds to the 37 Hunger Network centers throughout the county. United Way receives a very small portion to provide in terms of dollar amount for our fiscal services. They actually charge us 0.5%. So out of this $1 million allocation, they receive $5,000 to manage this contract. So it's very, to say the least, quite reasonable. So not only is United Way responsible for the financial oversight of the contract, but they also lead a team of staff and volunteers who conduct site visits to the hunger centers, and they review and analyze the satisfaction surveys that are received from the users of the families that visit the hunger centers, and to ensure that not only the families are satisfied with the services, but are can talk about the quality of the food and the amount of food they receive. Based upon satisfaction surveys that are done on a quarterly basis, each center does at least 30 satisfaction surveys on a quarterly basis. It's something that we've put into the contract several years ago, and we're pleased to say that over 95% of the families that visit the hunger centers are more than satisfied with the services and the quality of the food and the amount of the food they receive. So if they have additional questions, I think you've had presentation from United Way about this contract before. All the $1 million is all spent on food purchased through the Cleveland Food Bank. And Ben serves our liaison, and surely can answer any specific programmatic questions you might have.
No, I just want to state that I recommend going out to the providers. They do a great job in terms of oversight. I like oversight, and I've participated in seeing what their oversight is in some of the agencies. Open it up for a few short questions.
Yes.
Councilman Miller.
I have a comment, and first, it's a very, very important program. They work closely with the food bank, and we serve a lot of people. I just have a comment about the way this is worded, and I see this from time to time. The way this is worded, it sounds like all the money is for fiscal agent services. It says it's a contract with United Way for fiscal agent services, and where in fact 99% of the money goes actually to buying the food itself, and so I don't know that we need to amend this one, but I think we should think about in the future so that we don't create the misperception that we're spending a whole lot of money on administration, where in fact we're not.
All right.
Understand?
And what your ask is for moving this along?
Yes, for a second week suspension if we can.
All right. Why break the chain going today? Do I have my second? Moved and seconded. All in favor to move this to the full council for second reading suspension, say aye.
Aye.
Aye. All right. Thank you, gentlemen. Thank you for your time. Madam Clerk, if you can read the last item into the record, please.
Resolution number 2018-0259, authorizing an amendment to contract number CE 17000066 with Lutheran Metropolitan Ministry for emergency shelter services at the Men's Emergency Shelter.
Barry, you want to come up? Sorry. To your left. Good afternoon, Bob Math with the Department of Health and Human Services on behalf of Office of Homeless Services. With me is Shari Weir from the Office of Homeless Services. Director Gillette is in a conference down in Washington, D.C. this for a couple days, a conference about ending homelessness. So it's appropriate that unfortunately she's not with us, but she's in a good place given the topic. We're requesting an amendment to our contract with Lutheran Metropolitan Ministry to continue to operate the men's shelter at 2100 Lakeside for, through calendar year 2019. This contract was initially procured via an RFP that was released in November of 2016 that spanned the calendar years 2017 and 2018. As part of our monitoring process, this past March, my staff conducted a site visit at the shelter, which consisted of a walkthrough tour of the facility, observations, review of the 2100 Men's Shelter Policy Manual, building services records, and maintenance and safety documentation. In addition to the site visit, we reviewed 6 employee files to ensure that the orientation training standards were met, and they're taken directly from the community standards for emergency shelters. And our findings after our monitoring visits overall, we found that the men's shelter met expectations for all the standards during our site visit review. So we're pleased with the performance of Lutheran Metropolitan Ministry. So if you have some questions for Shari, and then we have Michael Searing and Aaron Cray from LMM, who actually responsible for the day-to-day operations of the shelter.
I would just like to add that in addition to operating the shelter, which runs amazingly well for the number of men who are served, LMM also coordinates with community partners. Overflow shelter for both adult males and the families, and they do that in conjunction with community partners.
All right, thank you. Thank you. Any questions in terms of, okay. I don't think I had any except for, this is just for an amendment to continue to 2019, the contract?
Yes,
Yeah,
329.
Okay, and when was it first procured?
It was procured the RFP was initially issued in November of 2016.
Okay, so we've just been amending them for a while. When would the
Well,
next?
the first contract was for a year and a half. So
Okay.
this is actually the first full amendment for calendar year 2019.
Okay. And when will you do the whole RFP process and all that again?
We built in the RFP another option year.
Another
So
option
it's
year,
conceivable that we not issue new RFP until 2021.
Okay. You have a question, Councilwoman Brown?
Is there any increase?
There was a slight increase, and there's multiple funding streams that come into, this contract. There was a slight increase of about, I think it was about $200,000 from 2018 into 2019.
And you say multiple funding streams, but ours said this is just 100%
Our-
funded by the HHS.
Yes, these dollars are 100% levy dollars.
Okay.
So $200,000 slight increase from 2018 or 2017?
It's actually 2018, 17 and 18.
Gotcha.
I have a question.
Yes, Councilman Miller.
The $2,082,000, is that just the levy dollars, or is that the entire funding package?
Councilman Miller, through the chair, those are just levy dollars.
And how much is the entire funding, including all the sources that are used for this?
I'll introduce Michael Searing from the Lutheran Metropolitan Ministry. He can talk about the other funding streams that come into to operate the men's shelter.
Hello, thank you, council. Our entire 2100 budget is about $3.2 million.
And looking at the levy amount itself, is the levy amount itself $200,000 more than this year, or is that regarding the entire funding package?
Councilman Miller, through the chair, that last year the levy dollars was about 1.7 million. So this is, about $250,000 more.
Okay.
Councilwoman Brown.
Yeah, and you indicated the first contract is for a year and a half, but this one is for a year. Am I understanding that right?
Councilwoman Brown, through the chair, it was, when we were asked to do the RFP, it was kind of mid-year that one year. So that contract started in May of 2017.
Right.
And council wanted us to pursue it, enter a contract from May of 2017 through December of 2018.
So just so we're clear,
This is why this is the amendment.
so just so we're clear, the 1.7 million was for a year and a half, and we have a $250,000 increase for 1 year. Has there been an increase in clients for the homeless services?
Our numbers have been roughly flat at 3,500 guys a year, and we average over 400 per night.
Okay, so can you explain the $250,000 increase for a shorter time and shorter time frame?
The majority of the increase is actually paying for the family overflow shelter that we run. It's a small portion of this entire contract.
And have their services increased? If we're flat with the number of people that we're serving, has their rate of providing services increased? Is that what you're saying?
Yeah, the numbers there, they are extremely variable. We had a high this summer of over 175 families, and our average is probably closer, 175 people, not families. Our average is probably had been closer to 50, so that has been a very large increase.
Okay, thank you.
All right. I will make a motion to move this to the full council for second reading suspension. Why break the chain? Is there a second?
There's a second.
Okay, moved and seconded. All in favor, say aye.
Aye.
Thank you. Thank you, gentlemen, for your time. Any miscellaneous business? Anyone signed in for any last public comment? Thank you. This meeting is adjourned.
And